All right, let's talk about something that affects every single one of us. HIPAA. And look, I know what you're probably thinking. Dense, complicated legal stuff, right? Well, forget all that. Today we're going to break it down as a super practical guide for you, the patient, so you can actually understand and control your own health information.
You know the drill, right? You've definitely been there. You walk into the doctor's office, they hand you that clipboard stacked with papers, you're not feeling great, and honestly, you just want to get it over with. So you scribble your name on the dotted line. But have you ever stopped to think, what are we actually agreeing to when we sign those? Yeah, that form, it's so much more than just a piece of paperwork. Now, I want you to think about it this way. All of your protected health information, your PHI, it's basically your personal health story. It's got some of the most private, sensitive details about your life in it. And HIPAA? Well, HIPAA is the rule book that dictates exactly how that story gets told and who gets to read it.
Okay, so let's jump into the most powerful part of this whole thing, your rights. And these aren't just some vague legal ideas. No, think of them as your personal toolkit, the things you can actually use to take charge of your own health story.
So what's in this toolkit? Basically 4 core things. You have the right to see your info, the right to fix it if it's wrong, the right to know who's seen it, and the right to put some limits on who gets to see it. Let's dig into a couple of these because they are real game changers.
This one is huge. It means you're not just a passive subject in your own medical record. You're the editor. If you spot a mistake, maybe a wrong diagnosis or an allergy that isn't yours, you have the legal right to ask for a correction. It's all about making sure your story is being told accurately.
And it's not just a right in theory. There's a real process here. All you have to do is make a request in writing to your provider or hospital. The moment you do that, a clock starts ticking. They have 60 days to act on it. So, you have a clear step-by-step way to get things fixed.
Okay, so your story is accurate. That's step 1. But what happens next? I mean, your information doesn't just sit in a filing cabinet at your doctor's office, right? Well, you have the right to follow its trail.
This is something called an accounting of disclosures. Now, to be clear, this isn't going to show you every single time a nurse glanced at your chart for your treatment, but it does show you when your info was shared for other reasons. And you can ask for this record going back 6 years. It's kind of like having a sent items folder for your most personal data.
And that brings us to the part that, let's be honest, can get really confusing for a lot of us. The actual rules of sharing. Who gets to read your story? And when do they need your permission? Okay, let's break down that paperwork we all sign. First, there's the Notice of Privacy Practices. They have to give you this one. It's the law. It's their rulebook. Then you have consent, which is more of a general permission slip for the usual stuff, treatment, billing, and so on. But authorization, that's the big one. An authorization is when you give specific, written permission for them to use your info for something out of the ordinary.
So that begs a really important question, doesn't it? If you need to give this special authorization for some things, are there times your health story can be shared without your permission at all? The answer is yes, and it might not be what you expect.
Absolutely. In some very specific situations, your information can be shared. These are usually cases where it's considered a matter of public interest. Things like, say, reporting infectious diseases to public health officials, responding to a court order, or even for law enforcement purposes. It's a balancing act between your privacy and public safety.
But of course, sometimes your info gets out not because of some rule, but because the rules were flat out broken. We're talking about a data breach, and that is a direct threat to your story.
So what exactly is a breach? The legal definition is actually pretty wide. Here's the key thing. Anytime your info is disclosed without permission, the law assumes it's a breach. The burden of proof is on a hospital or clinic to prove that your information wasn't compromised. It's on them, not on you.
Now, if a breach does happen, you need to remember this number, 60. Providers have at most 60 days to let you know your information was compromised. And here's the catch. That 60-day clock starts when they find out about the breach, not necessarily when it happened. That's a really important distinction.
And look, a breach isn't just about feeling like your privacy was violated. It can lead to something way, way more serious, medical identity theft. This is a nasty crime where someone uses your personal info to get medical care, fill prescriptions in your name, or rack up huge bills with your insurance.
And this isn't just some theoretical risk. Listen to this real-world story. A woman named Andori Cromar was a victim when someone stole her identity to get maternity care. The fallout was just devastating. Child Protective Services even threatened to take her kids away. It shows you just how personal and how high the stakes can get with this stuff.
Okay, so we've covered a lot of ground here. Some of it pretty scary. So how do we flip the script? How do you go from just being a character in your health story to becoming its author? How do you really take control?
It really boils down to a few powerful actions. First, know your rights. You can see your records, you can fix them. Second, actually read those forms before you sign. Seriously. Third, ask questions. If you don't understand something, make them explain it. And finally, remember this. If you think your rights have been violated, you can and should file a complaint with the Department of Health and Human Services.
And that really leaves us with one big question to chew on. Think about it. With electronic records, smartwatches tracking our every move, and all these health apps, our personal health story is being written in a million different places at once. So as things get more and more complex, who do you think should be the ultimate gatekeeper of that story?